Hi there, welcome to Ask the Chiropractor, your source for ultimate health, healing, and chiropractic-related information. I'm Dr. Adam Rodnick out of Commerce Township, Michigan, and I'll be your host today. We're here with two wonderful guests here. We have Dr. Ken Hamilton.
How are you?
And we have Dr. Chris here.
Hi.
And welcome to the show, guys. Glad to have you here. So we just want to start off with you guys about a little bit about how you got into the profession, some of the amazing things you've seen in the years that you've been in the profession. I know that, Doc, you've been in the profession for 29 years going on.
Yeah.
And I'm sure you've seen some amazing things.
Yeah, actually this Saturday will be the 29th anniversary of my graduation. I can hardly believe how time flies. That's true, and we have seen some stuff.
Absolutely. And Dr. Chris, fairly recent graduate.
Yeah, I'm kind of the new kid on the block in the chiropractic world. Recent graduate of Life University in Marietta, Georgia. I graduated just in September, just a few months ago, and hooked on with Dr. Ken Hamilton in St. Clair Shores shortly after that in October. So we're coming out of the gate flying, and it's been a very interesting couple months for me. It's been a lot of fun.
Excellent. So we're going to hear from both sides of the spectrum here. And for either of you guys, did you have a powerful testimony or anything that drove you into getting into the profession? I know a lot of people, as they become chiropractors, they had a profound experience that drew them into it.
Absolutely. Well, I know for me, being a recent graduate, one of the things that got me in the profession was I got a chance to observe. I didn't really grow up in a chiropractic family, in a chiropractic setting in that sense. So I didn't really know a whole lot about what was going on. And for me, actually going to work for a chiropractor in Brownstown, Michigan, I worked with Dr. Chuck Ribley down there. We had a fantastic time in the office. We had so much fun. I had a great time just kind of witnessing a lot of the things that were going on in the office. And I knew that that was going to be for me. I knew that I could definitely make a profession out of it and definitely make a lifestyle out of it. And I've learned kind of as I've gone along that chiropractic is definitely a lifestyle, and we have such a good time with it. We have a lot of fun.
For myself, growing up as a child, I was a sickly kid. I had a lot of issues, asthma, allergies, eczema. I was in and out of U of M Children's Hospital almost every other week. And so I spent a lot of time with the medical profession. I'm here because of them, so I'm happy about that. But I had developed an idea of my own, even as a kid, that the job of the patient and the doctor were the same, and that was to try to get the body to do what it was supposed to do from the factory, if you will. And I really didn't talk to very many people about that because that was a radical concept at the day, you know. And so I really kept that to myself, but thought to myself, I really have to figure this out. And I went to school, went to college, got my teaching degree, worked for 4 years, and one day I met a chiropractor, Donald Pethel, and I was observing him in his office one day, and he said to a patient, you know, Mary, the power that makes the body heals the body, and my job as a chiropractor is to turn that power back on. And I looked at him like this, what did you just say? And it's true. That was my idea. So I didn't even know chiropractic was a profession. So at 25, I was introduced to the whole idea, which I thought was my idea. And here was a profession that had already been on the planet, changing lives, saving people for 75 years already. So. And
you know, we tell so many people about what we do, about how it works, that we say, you know, the body has this innate ability to heal, innate ability to function, and we want to work with the body's natural ability. And people, it just makes so much sense to people that they think, I should have thought of that myself.
Oh, yeah.
You know, the body does have this ability. We want to just work with the body's natural ability to heal. And so there's definitely a lot of misconceptions about how chiropractors may differ from medical doctors or how we may compete with medical doctors. And it's definitely a misconception. You know, we obviously want to work with the community, work with the other members of the medical community. And I know we were just talking recently, Doc, about a patient of yours who's a medical doctor and some conversations that you recently had.
Oh, I had a great experience. This was last week. Ann is her first name, works at one of the area's most noted hospitals. And she had right arm numbness, had already consulted her peers at the hospital. They told her she had brachial neuritis, and she came into my office because she was a little concerned about being in the profession. She was concerned about actually covering up the symptoms, but not actually fixing the cause. She was real concerned about the side effects of all the meds because she's very aware of that. And I said to her, Ann, hang on 1 second. Let's do this. I'll be right back. So I went in the other room and I got a piece of paper. And the first thing I did before I got to the paper is I showed her the brain sits up on top, spinal cord comes down through the middle, and your nerves exit through these holes in between the vertebrae called the IVF or the intervertebral foramen. We can call it a hole today. So if you had lights in your body, which you don't, but if you did, they would look like this. And this would be happy, go, health is on kind of a look. When a bone gets stuck out of position, it causes pinching and pressure on the nerve because it makes the hole small, and that causes the problems, and that I said to her, that you're experiencing. I said, so on the street, because you're a medical doctor, you would hear chiropractors use the phrase, you have a pinched nerve. I said, but in the hospital, you're going to hear people in physical therapy say, you have a muscle spasm. Oh yeah, that's true. And I said, if you talk to the orthopedic surgeons, they're going to tell you that you have stenosis. Well, she said, I've heard that too. I said, let's try this. And so we made this, and it's got the bone and the nerve and the disc and the IVF and the muscle and the swelling and the pain and the motion all in one spot. And I said, now let's imagine this. You're bending over a patient, which she does all day long because she's a general surgeon, and the bone in your low back goes out of place. Now the bone has gone out of place. Now the disc, so we can do this just like this. Now the bone has gone out of place. So the bone's out of place.
Got the bone.
Now the disc goes out of place with it because it's intimately attached to the vertebra above and the vertebra below. So now we can also talk about, does she have some disc involvement? Absolutely. That's true. Does that make the hole through which the nerve pass get small? Well, we just showed that. That's true. So now the intervertebral foramen, or the hole through which the nerve passes, gets smaller. So now she's got some stenosis, or a small hole. Ultimately, does that result in some pinching and pressure on the nerve? Yes, it does. So I said to her, I said, now, Ann, do you remember what you had for lunch yesterday? She goes, well, yeah, I had corned beef sandwich in the hospital cafeteria. Okay. So are you a food scientist? No. So do you know what the chemical components of your food were? No. But did your body digest it? Yeah. And the good parts became you, and the rest of it somewhere else. I said, so you're sitting right now, so your blood pressure you already know is lower, your heart rate is lower, and your respiration rate's lower. As soon as you stand up, that's instantaneously going to change. Oh, that's absolutely true. I said, so your body knows what you ate, and your body knows that you're sitting, and when you lay on my table, it's actually going to go lower still. Do you think it knows that you have a bone out of place, a disc out of place, the hole through which the nerve passes got small, you got pinching pressure on the nerve?
Absolutely.
And she goes, well, absolutely. I said, so now, do you think it'll have a response? Just like when you sat, its response was to lower all your values. When you ate, its response was to digest the food. Is it going to have a response to that?
Absolutely.
Absolutely. I said, so the response is the body lays down fluids of inflammation, called swelling, if you want to call it that, you can call it that. So now you have swelling, and it's also going to tighten up the muscles in the area in an effort to put you in a state of naturalized splinting. I call it a state of physiological lockdown. The body's trying to keep you from hurting yourself more. So the muscle spasms and the swelling are in response to that. Ultimately, you're going to get some pain. The body's also telling you, please stop doing whatever it was that you did to cause this in the first place, and you're going to lose some motion. I said, now, in our office, some of the things that I may say might sound a little bit different than that which you've been exposed to in the medical community. And it's that way on purpose because I want to look at the cause, and I therefore want to look at the whole issue. If we give you pain meds, we fix the pain, but what about all the other items? They're still there. If we give you anti-inflammatories, have we taken care of the swelling? Yes, but we still have all the other items. If we give you muscle relaxers, the job of the chiropractor is to take the hard bone, take it off the soft nerve, turn the nerve back on, and then the body's natural response will be to help fix everything else.
You know, where we see a lot of problems that people have in the community is, let's grab the muscle component, right? And so let's say we have their little muscle component here.
I get it.
Right away, they go into spasm, right? And most people believe, obviously, that that's a terrible thing, that's a bad thing, we don't want to have a muscle spasm. Well, their body was, as you said, doing natural splinting. Just like, let's say someone breaks a finger, we put a splint on it to prevent further damage, further inflammation, all sorts of damage to the joint. So now what is the first thing most people do? They go right to the drugstore and they get a muscle relaxer. Muscle spasm goes away. They're now possibly more likely to do more damage to the joint, more damage to the nerve in the long run. So we know that the body has symptoms for a given reason. We want to find out what the cause of the problem is, get to the bottom of the cause, rather than just treating the symptoms, which sometimes could cause more further damage down the road. Now, don't get us wrong in the studio here. There's definitely time and a place for all types of healing arts and the muscle relaxers and etc. But many times we see people do further damage because of certain things like that.
Absolutely. And actually, we continued our conversation with her, and I said, and it is true and I actually have some sample MRIs in our office. I said, it is true that sometimes the disc is the prevailing problem. You really do need to focus on that. And it is true that we send patients in our office out for physical therapy if those muscles need to get worked on a little bit more.
Absolutely.
It's true.
Right.
So you have to have a team approach.
And everyone has their own given specialty, right?
Right.
Exactly. And I really like how you termed it, Doc, that different words are going to be used to describe the same problem.
Right.
And so a lot of times people will think all these different doctors, everyone had their own opinion. Well, perhaps it appears that way, but it could very well be the same thing. We as chiropractors may have said you have a pinched nerve or vertebral subluxation complex, where the orthopedic guy said you have spinal stenosis. And sometimes they may say, don't see a chiropractor, or sometimes the chiropractor say, don't see the orthopedist. But in reality, we're all looking at the same thing. We have the patient's health as our main goal in mind.
Yeah, and I think the key with this is that, as Dr. Ken was saying, the goal in chiropractic is to treat all of these symptoms. We look at everything. We look at the bone, the nerve, the disc, the IVF, and we try to put the whole picture together for the patient. And that's maybe where chiropractic can separate itself from other options out there. And I think we're very successful with that.
Absolutely. Now, disc is a term that a lot of people don't really understand or don't really know what it is. They just hear, you know, have a slip disc or hernia disc. So I'll just briefly show that to our audience here. Normally, we have these discs between the spine. These are like shock absorbers. Think of them almost like sponges. Okay? Now, when we have decreased motion or lack of motion here in the vertebrae around it or in the joint itself, the good things like water and minerals and nutrients can't come into the disc. And the bad things like scar tissue, inflammation, cellular debris doesn't leave the disc. So over time, if we think about it like a sponge without water to it, it starts to slowly shrivel up, starts to dry out. We could take a wet sponge, stomp on it, it's going to poof back up. But if you take a dried out, wrinkled up sponge and do it, parts of it could crack or could break. And so this is what it looks like once it starts to shrivel up and wear away. And the body, again, is so smart, and it knows that it's starting to shrivel up and waste away, and starts to place its own calcium deposits around the joint, around the disc, to help strengthen it. And that's what we call bone spurring or osteophytes. I know that's a common term that people use, bone spurs. And so that's what they start to look like. And they're a good thing because they start to strengthen the instability, but unfortunately, if it continues for long enough, then the bone starts to touch the next bone, and we call bone-on-bone arthritis. And that's where it definitely becomes much more troublesome or much more serious to the patient.
Yeah.
And then this model here shows what a herniated disc will look like. Now the disc, think of like a water balloon. You squeeze it hard enough, part of it will poof out. That's what the herniated or slip disc will look like. And that can also cause more swelling and more pressure pinching on the nerve.
We've seen a lot of people, even in our office recently, that seem to be dealing with this component of arthritis or degeneration. They've maybe been told by a medical doctor or physical therapist that they may have some of that going on. And it's actually the perfect scenario for a chiropractor. We are trained to treat arthritis and trained to treat this. And the number one reason why is that we restore motion to the spine. As Dr. Adam was saying, when we have some of this extra bony growth, the area tends to get locked down, maybe in a state of this physiological lockdown. And as chiropractors, we restore motion to the joint, and the body, in a sense, is allowed to heal itself. Neurologically, it tells the brain, hey, send me more muscle tissue, send me more ligaments, send me more nutrients, more water. And the disc, in a sense, when we adjust it, it'll give a chance to heal itself. We can pump water and nutrients right back into that, and even though we cannot restore some of the bony growth that's already been on there, we can prevent it from advancing further, and that's really a key component with that.
And that is a big buzzword in our community, arthritis. And a lot of people will hear, you know, oh, if you have arthritis, chiropractor, you shouldn't see a chiropractor because it's so bad, you have arthritis. And it's on the contrary. That's something that if you have arthritis, you should absolutely see a chiropractor. With
First
something
stop.
Absolutely.
First stop, exactly.
First stop.
I have an expression we like to use. I always say natural first, drug second, surgery last. There's a time and a place for the biggest and baddest of all surgeries. There's a time and a place for all sorts of drugs. But I always say, why not try natural first, drug second, surgery last, in that order. Unfortunately, some people go right to surgery first. They skip the other components. They skip the other steps. So, Doc, you were talking about your process of getting into the profession, that as a child you were sickly and you had asthma and allergies. And I know this is a misconception that a lot of people think to see a chiropractor you have to have crippling back pain, you have to be bent over like this, or maybe even have a herniated disc. And they don't think at all about chiropractic with children or anything to do with that whatsoever. So let's get into a little bit about why chiropractors see children, some of the conditions that we see children with, and more importantly, the conditions we don't see children with that we just want to keep a healthy nervous system and a healthy spine.
I have two examples that actually are my own children. So Sarah and Billy were both very asthmatic, which of course they got from me. And Sarah actually became a very good swimmer. She was #1 in Macomb County for her event, and but she always suffered from exercise-induced asthma. And so we set up a program with her where we did take her to the asthma doctor, and I did adjust her. And I actually went to all of her swim meets, and she'd get out of the water, be wheezy. She'd sit between me, I'd adjust her, and she'd go right back in the water and win again. And in fact, it worked out so well with Sarah and Billy, the response that they got through chiropractic, that their asthma doctor ultimately became our patient, and has brought in her entire family.
That's amazing. I'm sure sent you a lot of other asthma patients.
Yeah. So it has really been a fantastic thing. So just talking about that, by restoring function in the body, or by restoring normal nerve flow, function is restored, and their lungs clear out.
Let's get into a little here. We'll get back to children and some of these other conditions in a second. But let's get into how something like a chiropractic adjustment, what people may think is laying at a table, having them crack your back, how that could affect something like asthma, which is constriction in the bronchioles and in the lungs. And the reason is that these nerves, we have 31 pairs of spinal nerves that come out all through the spine, and each area controls different aspects of the body. These nerves at the top, they control things like eyes, ears, nose, throat, sinuses, brain function. So there's dozens of different symptoms that someone may experience if they have problems there. Unfortunately, they also may not experience symptoms. They may have this problem for years without experiencing symptoms, and later on down the road would. So again, it's important to get our spines checked on a regular basis, just like it is to see a dentist. Even if your teeth, you don't know you have rotting away teeth, it's important to get your teeth checked as preventative maintenance. And it's the same thing with the spine. I always recommend that everybody should have their spine checked on a semi-regular basis just to see if there's any problems in it whatsoever. Because many times, again, we could have some misalignment, or we could have some interference, that non-healthy nerve signal, without necessarily knowing it. But again, these nerves here with eyes, ears, nose, throat, sinuses, and brain function, what are some of the symptoms we may notice in some of those nerves? People could have headaches, they could have neck pain, they could have dizziness, they could have blurred vision. And what would some of the symptoms for children be if they have problems in this upper cervical area?
I know I recently had a patient in the office, actually today, this morning, believe it or not. We were in the office today, and a little kid came in. I think Leo is probably going around maybe 2 years old now, so he's very little in that respect. And he had actually quite a bit of a runny nose going on. So we actually checked the second bone in his neck, that's C2, and that one is usually responsible for a lot of sinus conditions. It controls a lot of the mucous membranes in the nasal cavity, and even down the throat. And we actually got on the second bone of the neck and the first bone on the neck, the atlas. We made the adjustment right in there, and he got off the table, was very happy. He responded quite well to the adjustment, and I'd imagine he's doing just fine right now, actually. Everything should go very well for him.
That's amazing. And these same couple nerves here, sinuses and ears, I just had a woman give me a testimonial this week that her 3-year-old last year had 6 to 7 different ear infections, fairly severe. They were on antibiotics. They were going to think about putting tubes in the ears. This year, since they've been under chiropractic care, the little guy hasn't had 1 ear infection.
Wow.
Right? And so
that's so marvelous.
Yeah,
isn't that
it
great?
is. Absolutely,
Really is.
absolutely. So as we get down the spine, each area controls different spots. So down at the very bottom of the neck here, we were talking about the brachial neuritis. These nerves, the very bottom here, can go right down the arm. So a lot of people will think they have numbness and tingling in their fingertips, or even sometimes they'll think they have carpal tunnel because it's a very common condition, or it's a very public condition. Everyone thinks anything in their hand is carpal tunnel, or many times, something could be pinched in the tunnel here, or it could be pinched in the elbow or the shoulder, or more commonly what we see in the neck. The nerves come right down the arm. So something that we have really great results with.
Yeah, and that's going to be a common misconception among the public. People may think, oh, my hand hurts, or my forearm hurts, or my lower leg hurts, or my foot, and they think that they maybe have a problem with that area. Then they think, yes, my hand or my foot hurts, and that's where my problem is. When in effect, you have a nerve that's actually traveling out right from the spinal cord all the way down the arm, or out of your low back, all the way down the leg. And if we look to that area first to make the correction, usually it results in a much better outcome.
Exactly. We think of the spine as a fuse box, right? And when the power goes out in parts of the house, we want to go right and check the root of where the power comes in, and that's the fuse box. So if any of these fuses, what we see, we call these spinous processes on the back here, and they look just like a fuse in the house. Or when the lights go out in the kitchen, you don't want to sit there and change all the light bulbs or mess with the wiring there. Go right to the fuse box and check where it comes right out of the source.
Absolutely.
So moving down a little bit, some of these nerves control things like the lungs. We talked about asthma. The nerves a little lower, T4, we're looking more at our heart. Some of the lower ones here now, T6 we control our stomach, a little lower gallbladder, pancreas, spleen. T12 down here controls our kidneys. So a lot of times, believe it or not, again, this is not something we cure. As chiropractors, we don't cure people's condition. We just remove pressure so that the body has a better ability to heal. I see a lot of results with people that have had chronic or frequent kidney stones. That we take some pressure off the nerves here, and they're less likely to form those stones on the road because their kidneys are maybe able to function just that much better. A little lower down, these nerves control our lower back, and of course, the main symptom that people think of a chiropractor for is
some lower
back pain, right?
Absolutely.
But these nerves, they also control the things we don't feel here, things like our bowels, our bladder, our reproductive system. Have you guys seen some results with some of those things associated with the lower back?
Just the other day.
So what did you see there?
Oh, I had a fellow come in, and it was kind of interesting because he wasn't really quite sure how to say it to me. But he had had some surgery in the past for a prostate problem, and things weren't quite the same after that. And
I know he was having difficulty functioning.
He was having a bunch of function problems.
Yeah.
And he came in and he said, "Dr. Hamilton, my wife wants to thank you." And he said, for the first time in 3 years, I functioned completely like a man Saturday night.
Completely like a man, huh?
He just couldn't, he had tears in his eyes.
He
was so happy.
And I've seen that quite a few times too. It's an amazing thing, and it's something that a lot of times the patients won't even tell us until down the road later.
Yes.
And I've heard from the wife down the road, you know, the man was, you know, maybe too embarrassed or something to even mention anything.
Absolutely.
But again, these nerves control the reproductive system, so we can have a lot of problems with that if obviously we have irritation or pinching there.
Right.
And same thing with the female reproductive system too. A lot of times we've seen results with infertility. We've seen results with very painful or frequent menstrual cramps. All sorts of different things like that. And again, not that we cure those conditions, but just from removing pressure, let the body function and heal at its optimum genetic potential or its optimum innate potential.
Right.
Absolutely.
Yeah.
And so what are some of the other things you guys see in children? Like you said, growing up yourself, the asthma, the allergies. What other things have you guys seen the results with children?
We had a gal in the other day, had been on her she was at that point on her 5th course of antibiotics for ear infections, had been out of school for many days because she was miserable. And we adjusted her, and again, it was a deal where her atlas just really clunked in, and it was marvelous. It was really beautiful. And her dad was like, whoa, because her dad was not a patient. They were actually referred by the pediatrician down the street.
That's amazing.
Into my office. And the gal got off the table. She was 5, and her eyes just got really big, and she was really excited. Still a wee bit miserable because she'd been miserable for days. Scheduled her for the very next morning. She came in the next morning. How you doing? Well, there's a bunch of stuff running out of my ears, but you know, she feels better. Her mom brought her in, and we adjusted her again. And now she's on a very reduced schedule. She's coming in like once a week, and she comes in, runs the front desk with the girls for a little while, gets adjusted, and her dad says, as soon as I turned on to 11 Mile, I can barely keep her in her car seat because she's so excited about coming into your office.
That is awesome.
It's a beautiful thing, and even her pediatrician is just totally delighted with her.
So let's talk for a second here. With chiropractic with children, a lot of people have a misconception of what a chiropractic adjustment actually is or what it looks like. You know, they see too many Chuck Norris movies where they sneak up behind them, crack the neck, and they think, wow, it's very dangerous. I would never let my children go through something like that. Let's talk about how gentle and how easy it is for children to undergo chiropractic adjustments.
Absolutely, and we have to keep in mind that, you know, a child's adjustment is certainly different than yours or mine spine in that situation.
People don't think that it would be.
Yeah, everything is very much designed a little bit differently, and we will not go about and use the same techniques to adjust a child as we would an adult in that situation. It requires much less force in a sense and much less effort to even adjust a child's spine. Still very important and very beneficial, but it's not really the same process that goes on.
And even a different process between, let's say, a 2-year-old child and an infant.
Absolutely.
An infant is a totally different story, too.
Yeah. To adjust an infant, it just takes a little bit of that sustained pressure, arguably right on that first bone in the neck or the second bone in the neck, to really make the correction in their nervous system. That's all that it really takes. Very, very low force, very safe.
And so let's get back to, you mentioned a minute ago that the pediatrician had actually referred them in. So let's get back to, again, why it's important that we work as a team. Chiropractors, pediatricians, pharmacists, that everybody should work together. You know, if that didn't happen, that child would have possibly suffered for years from that particular incident.
Hearing loss, who knows?
Hearing loss, absolutely. So again,
in the case of this pediatrician, I've actually never met her. but she's heard of our work, and we've been around long enough, and she sends us patients often, and this patient has this, this, and this. We work on them and send them out, and then talk to them about chiropractic and the body's ability to heal itself. And it's pretty exciting, and it's great to have that reciprocal relationship.
Often I like to use the analogy of the fireman and the carpenter. Right? I like to use the analogy that more of the medical professional are similar to, let's say, a fireman, where a chiropractor a lot of times is similar to the carpenter. We want to work on the frame. We want to build up the structure of the house, right? Where if you have a fire, don't call the carpenter, right? Call the fireman. What are they going to do? They're going to put that fire out, no question. And that's obviously more of an emergency care than your normal, well baby checkups and things like that.
Yeah.
But they're going to put out that fire, the fireman.
Right.
What are they going to do? They're going to kick the door in. They're going to get water all over the place. The place is going to be a mess when the fire's out. So then who are you going to call? Then obviously you want the carpenter to come back in and fix it up. And it's something that we can work as a team constantly and thoroughly between chiropractors and the medical profession throughout someone's life.
Right. Oh, it absolutely just makes common sense.
It's important for routine maintenance and routine checkups. I'm sure you have patients that, they came in regularly for corrective care, or they came in regularly for some symptoms or problems for a long while, but now they don't see you on a regular basis, but they come in periodically for checkups or for maintenance.
Yeah, and it's important that people can make that next step. They can transition maybe out of that relief phase of care where they've been having some symptoms or having some problems. And it's important they can then transition to a corrective phase where we can make those long-term corrective changes in their spine. It's very, very important. And then eventually they can transition into the maintenance period. That's kind of the last phase of care where, like you said, people just come in on a fairly regular basis to get checked.
And that's unfortunately where a lot of people come to us in the first place, is under that symptom mentality.
Yes.
They came because they have a certain symptom. Unfortunately, there's not a big public education about why someone should have necessarily maintenance. Most people don't come to our office in the first place because I heard I should have a checkup and just see what my spine looks like. That's what we'd love to get our profession to in the future.
Wouldn't that be great?
Right?
Absolutely.
Well, and it was the same thing with dentistry, 100 years ago, where people wouldn't go to a dentist unless their teeth were ready to be pulled out. And so now people go to a dentist for regular checkups, for regular maintenance, for teeth cleaning. And that's what we would love to see people come to a chiropractor without symptoms, just for a regular checkup, even if every once in a while.
Absolutely. And I think we would see definitely an increase in wellness in our overall profession if people were of that mindset a little bit more frequently.
Absolutely. So we just have a minute or two left here, and I would love to go over one more testimonial that maybe you've seen.
Yeah,
in one of the
absolutely.
offices.
Well, on that same note, we had actually a young girl come in the other day, pediatric. She was having actually diagnosed with mononucleosis. She had mono, and when she came in, she was looking, quite peaked in a sense. She was very white, very pale, no energy, very, common symptoms of mononucleosis. And we adjusted her actually very, very easily, and she was fine after just a few visits. It was quite an interesting turnaround. I've never even experienced something myself in my own career, quite such a quick turnaround. I've seen people suffer with mono for months at a time, and this person, she was adjusted, I think maybe 5 or 6 times, and she looked like night and day compared to when she came in. Very, very cool.
When I walked in the room yesterday to adjust her, she was sitting on the table doing homework.
Yeah,
doing homework,
just hanging out.
Like
She's
nothing.
like nothing was wrong. She was
Doing her high
there,
school homework.
she was there just to receive again that maintenance sort of adjustment and get checked up, make sure nothing was going to go wrong.
And who knows?
And it was great.
If this didn't happen, she may have suffered with that for weeks.
Who knows?
Maybe
Yeah,
months.
who knows how long
it could become much more severe.
Yeah.
So thank you guys so much for joining us on the show today.
Thank you, Dr. Rodnick.
Yeah.
So again, I'm Dr. Adam Rodnick out of Commerce Township, Michigan. This has been Ask the Chiropractor, your source for ultimate health, healing, and chiropractic-related information. Remember that God gave us the gift of life, and what we do with that life is our gift back to God. We'll see you next time on Ask the Chiropractor.